Suboxone treatment for opioid withdrawal symptoms. Tackling many obstacles on your journey from addiction to transition is hard enough, but opioid withdrawal symptoms make it that much harder. Opioid use disorder is a severe mental health disorder that can have devastating consequences. The number of people suffering not only from the effects of opioids, but also from the effects of withdrawal is rapidly growing at an alarming rate. Opioid addiction has now become a national health crisis all over America. There are several strategies for treating opioid withdrawal symptoms, but one of the most reliable is medication-assisted therapy, or MIT. Suboxone is a drug used in MAT to assist individuals in weaning themselves off opioids, managing their withdrawal symptoms, and pushing forth all beneficial outcomes that treatment can give. If you want to understand more about Suboxone as a treatment not only for opioid addiction, but also for severe withdrawals, watch this video. Suboxone is one of the most easily dosed, accessible, and affordable MATs composed of two active ingredients, buprenorphine and naloxone. Buprenorphine is a partial opioid agonist, which activates the opioid receptors in the brain much less than other opioids like heroin, illicit drugs, or fentanyl. Being a partial agonist, it acts as a buffer to that euphoria which results in pain relief and feelings of pleasure, but to a much milder extent. Naloxone, on the other hand, is an opioid antagonist which blocks the effects of opioids and opioid dependence or opioid withdrawal. Suboxone comes as a sublingual film or tablet that can be placed under the tongue to dissolve. It helps keep you from experiencing severe withdrawal symptoms and fight the effects of long-term addiction. It is an essential factor in this treatment period. Like all medications, Suboxone has a few side effects. They are normal and may disappear in a certain amount of time. The most common side effects are drowsiness, constipation, nausea and vomiting, headache, dizziness. It is essential to remember that not everyone will have the same experience taking Suboxone treatment. Each person may have different reactions to Suboxone, depending on their condition. Having buprenorphine act as an opioid agonist ensures that these side effects have a soft buffer. These symptoms should not be a worry unless they frequently happen and are at an excruciating pain level. According to the National Center for Biotechnology Information, or NCBI, opioid use disorder, or OUD, consists of an innermost desire to use opioid drugs, a correspondingly high tolerance, and withdrawal symptoms upon discontinuation. OUD is classified into opioid dependence and opioid addiction, with addiction being the more extreme form of non-illicit and illicit drugs. It means someone with OUD will feel a compulsive need to keep using opioids even if it negatively impacts their life. They will also experience withdrawal symptoms if they try to quit. Withdrawal symptoms from long-acting opioids can be both mentally and physically taxing. Its severity depends on factors, such as whether the patient has been addicted for a long time or is using other substances along with opioids. In some cases, opioid withdrawal can be so severe that it requires medically supervised withdrawal to ensure the patient's safety and comfort. MAT is a detoxification process, using medication to help ease opioid withdrawal. It makes life easier for those with opioid addiction. MAT is also paired with a dual diagnosis treatment that incorporates medication and other forms of rehabilitation, such as behavioral therapies carried out by healthcare providers and counselors. It is vital because opioid drug addiction is a disease that affects the patient and those around them. It is crucial to get help from a professional to recover. Medically supervised withdrawal in an inpatient setting and an outpatient basis has shown beneficial outcomes that include aftercare checkups in and out of our facilities to ensure that everything at home remains in tip-top shape. It creates a sterile environment away from long-acting opioids. Withdrawal symptoms from opioids can be both mental and physical. They can vary widely in severity. The withdrawal experience depends on how long the person has been addicted to opioids and whether they are using other substances along with opioids. Remember, every detox is different. Opioid withdrawal does not look the same for everyone. Therefore, there is no one-size-fits-all in this challenging phase in your journey to sobriety. Withdrawal happens when someone using opioids for a long time suddenly stops taking them. Their body goes into shock because it is no longer receiving the drug it has become dependent on. It can cause various withdrawal symptoms that can be very draining to both body and soul. Withdrawal from a third person is as terrifying to someone experiencing them firsthand. It can feel like death, with symptoms that include intense cravings for opioids, anxiety, depression, agitation, sway, muscle aches and pains, insomnia, nausea and vomiting, diarrhea. With symptoms like these, your Suboxone doctor can brief you on everything you need to know about the treatment, from start to finish, and guide you during the entire period. One of the safest and best bets in inpatient settings for long-term treatment, as well as MAT, is a Suboxone prescription. Suboxone is one of the most accessible forms of treatment that have been proven more effective than other treatments, such as methadone. Methadone is an opioid that binds to the same brain opioid receptors as other opioids, but it does not generate the same high. Suboxone has the lowest risk of addiction to any opioid withdrawal treatment, ensuring the user's safety while reducing dependency due to the medication sticking to the brain's opioid receptors. At SuboxoneDoctor.com, our online Suboxone doctors can assist you by providing prescriptions from the comfort of your homes on an outpatient basis. Online access to various resources can also help start your road to recovery, especially with our online Suboxone doctors, who are board-certified and state-licensed online medical providers. With the advancement of technology, there are online Suboxone doctors that will help make the withdrawal process as comfortable as possible by providing resources and prescriptions online. It is essential because it helps ensure patients access medication while keeping them safe in their homes. Online medical providers are more than capable of providing treatment for patients anywhere in the United States by online appointments or telemedicine that can ensure that outpatient and inpatient settings are comfortable, safe, and assured of both health care and mental care during treatment and rehabilitation. Our providers seek to create a space safe to openly discuss your experience with opioids to help you better understand your unique case and how we can treat it in the most efficient way possible. Discreet online access to Suboxone will keep your medical records confidential. Rest assured, your trust and privacy are our #1 priority. Suboxone treatment for opioid withdrawal symptoms is one of the best long-term options available. It is crucial to seek professional help from a licensed healthcare provider or online Suboxone doctor to ensure a safe and comfortable detox process. Patients can successfully recover and benefit from opioid addiction treatment with the right resources. If you or a loved one are struggling with opioid addiction, seek help as soon as possible. You can start your road to long-term sobriety at SuboxoneDoctor.com. We pride ourselves in providing personalized solutions for all customers based on a profound understanding of their business. We believe in being a solution-based community that aims to give you everything you need as much as possible. Visit our website today and start your journey toward your new opioid-free life.